Assalamu alaikum. I am Dr. Yahya Noori and this is a new case. So, we are going to talk about a woman who underwent pap smear and what the findings were. So, a 35-year-old woman underwent a routine pap smear examination, and when the pathologist looked at the microscope, he or she saw enlarged epidermal cells with clear cytoplasm and peculiar nuclei which were irregularly shaped and were hyperchromatic. So before we jump on to the conclusions, I want to remind you that this is talking about a cytopathic effect which is caused by particular viruses, right? So when they infect the cells or when we do that experimentally in the lab, we see that cytopathic effect. So was it syphilis, trichomoniasis, chlamydial infection, candidiasis, or HPV? So if we look at the options, we don't know any cytopathic effect which is caused by trichomoniasis um, or candidiasis. So we move them out. Syphilis will not cause such an effect. We can move that out as well. If there would have been a herpes simplex infection, there could be a different type of cytopathic effect, that is giant cell formation. This particular cytopathic effect is known as Koilocytosis and it is a hallmark for human papillomavirus infection. So here's your answer, that is human papillomavirus infection. Oh, just don't go right now. We'll talk about it more. So these are the cells which are known as koilocytes. They are enlarged epidermal cells. They are characterized by a clear cytoplasm and a large ominous looking nucleus which is eccentric, quite irregular, hyperchromatic, and these are associated with HPV infection. Finally, I found a copyright free image so that I could show you here. So a little bit about HPV, the type 6 and 11. They are low risk viral types and they are associated with warts on the genitalia. This is known as condyloma acuminata. They generally do not progress towards cancer. While HPV 16 and 18 are high risk types and they are associated with cervical cancer. So if somebody asks you what is cytopathic effect, it is actually the morphological changes which occur in infected cells due to viral infections, and there are two examples here. There are many more, but just two examples here. One is giant cell formation because of the clumping of cells, and that is due to herpes viruses. And then there could be koilocytosis, the example which we just saw, and that could be because of HPV. There could be inclusions, there could be cell destruction, there could be other different signs as well. That's it for today. I'll see you again, inshallah. Assalamu alaikum.